What the Study Says.
Welcome back to What the Study Says. I'm Dr. Kai.
And I'm Dr. May.
So think about that chronic, nagging, musculoskeletal pain. You know, the kind that makes your knee ache constantly or your shoulder just clicks. Or maybe it's that throbbing in your foot.
Yeah, the kind where the usual treatments feel like they barely make a dent.
Exactly. Now imagine there's this treatment, just an injection, claiming it doesn't just cover up the symptoms, but actually jumpstart your body's own healing process.
It sounds pretty appealing, right?
Almost too good to be true, maybe.
Right.
Especially when you hear the main ingredient is basically, well, concentrated sugar water hypertonic dextrose.
So is this the miracle cure for chronic pain we've been looking for, or, is it a bit more complicated?
That's exactly what we're digging into today. We've got a major systematic review here that's the gold standard, pulling together all the best available studies. This one's from the VA Evidence Synthesis Program,
right?
Our mission, to really figure out what the science says about dextrose prolotherapy. Is it effective? And crucially, is it safe for these kinds of pain problems? Okay, let's get into the basics first. For listeners who might not be familiar, what exactly is dextrose prolotherapy? What's the theory behind injecting sugar water?
Good place to start. So prolotherapy involves injecting an irritant in this case, usually that hypertonic dextrose right into the problem area, like joints or ligaments.
Not irritant, okay.
Yeah, the theory is this irritant kicks off a sort of low-grade controlled inflammation. And it's that inflammation that's supposed to signal your body to start repairing the tissue naturally. It might even change how nerves are signaling pain.
So it's trying to trigger the body's own repair crew, not just numb the pain. Interesting concept. How common is this in practice? Is this something doctors are actually using?
It is used, yeah. In the VA system, for instance, they did over 1,400 procedures just in fiscal year 2023. It's also used quite a bit outside the VA.
Okay.
But here's the catch. Major insurance companies, they usually don't cover it, and there's no specific billing code, no CPT code for it.
Right. That makes it really hard to track how much it's actually being used or what it costs the system, doesn't it?
Exactly. It's a bit of a blind spot in terms of overall usage and cost data.
So lack of coverage, tricky to track. Does the evidence actually stack up? You mentioned this systematic review. What did it find about whether this actually works for different types of pain?
This is where it gets really nuanced. Let's start with knee osteoarthritis, super common problem. The review found prolotherapy showed probably little to no benefit for pain or function compared to just injecting salt water, normal saline.
Little to no benefit compared to a placebo injection for knees.
Okay.
That's pretty clear. What about shoulder pain, say bursitis or rotator cuff issues?
This one was surprising and frankly a bit concerning. For shoulder pain, dextrose prolotherapy probably resulted in worse physical performance outcomes when compared directly to standard corticosteroid injections.
Worse. Not just no better, but actually worse than steroids.
That's what this review suggests for physical performance, yeah. It really makes you pause and think twice about using it for shoulder problems, especially when there are other established options.
Definitely a major red flag for shoulders then. Is it all bad news, or are there conditions where it maybe showed some promise?
There are a couple. For lateral elbow tendinopathy, that's tennis elbow, and also for plantar fasciitis, that awful heel pain, the review said prolotherapy may improve pain-related functioning compared to saline injections.
Okay, so may improve for tennis elbow and plantar fasciitis. That's different from the knee and shoulder findings. Suggests it's very condition-specific.
Highly condition-specific. It's definitely not a one-size-fits-all approach based on this evidence.
And the crucial question with any injection, what about safety? What did the review say about adverse events or side effects?
This is another really significant point of uncertainty. The evidence on safety was described as very uncertain and generally lacking.
Why lacking?
Mostly because the studies were small and they just didn't report adverse events very well. What was reported tends to be mild to moderate pain right after the injection, usually lasting less than a week. Sometimes a temporary increase in back pain.
Any serious issues reported?
Very rarely, yes. For injections around the jaw joint, the TMJ, there were isolated reports of temporary facial nerve paralysis or another nerve issue called neuropraxia, which seemed to resolve over a few months. But again, these seem quite rare and the overall data is just thin.
So a very blurry picture on safety. Why is there so much uncertainty overall? What were the problems with the studies they reviewed?
Well, the review pointed out quite a few methodological weaknesses. Small sample sizes were common. Nearly half the studies had a high risk of bias, meaning their results might not be reliable.
Okay.
And there was just huge variation between studies, different injection techniques, different dextrose concentrations, different treatment lengths, different ways of measuring outcomes. All that inconsistency makes it really hard to pool the data and get a clear answer.
Right, like comparing apples and oranges sometimes. And didn't you mention the placebo effect earlier? That's always a big factor with injections.
Absolutely. Injection therapies are known to have a substantial placebo effect, which makes rigorous testing challenging. You need really well-designed trials to tease out the real effect from the placebo.
And what about cost? Especially for chronic conditions, cost and patient burden are huge factors.
Critical factors, yes. But very few studies even looked at the cost to the healthcare system, and apparently none properly evaluated the cost or the burden, like time off work, for the patients themselves. That's a major gap in the research.
Okay, so let's try to wrap this up. What's the bottom line for you, the listener, trying to make sense of this?
I think the key takeaways are pretty stark. One, dextrose prolotherapy is not a universal fix. Its effectiveness seems to really depend on the specific condition.
Right, seems okay for maybe elbow and foot, but not knee or shoulder.
Exactly. Two, for knee OA, evidence suggests little benefit over placebo. For shoulder pain, it might even be worse than standard treatments like corticosteroids. And three, and this is critical, the safety profile is really quite uncertain because the evidence is limited and poorly reported.
It really underscores that this isn't a simple yes or no treatment, which leads to a bigger thought, doesn't it? In this age where we're flooded with health information, how do we, both patients and clinicians, navigate treatments like this, where the evidence is so specific, so nuanced, and often, frankly, uncertain? What does this mean for managing chronic pain when we need both effective treatments and clear safety data, but the evidence just isn't black and white? Something definitely worth thinking about.
Indeed.
Make sure to subscribe and share this deep dive with your friends and colleagues.